We're here at the MedHealth Summit with Dr. Ram Peruvemba from HSR.Health. He's the Chief Medical Officer, and as always, these interviews being brought to you by Wobot Health's Meeting of the Minds, as well as Into Being's MedTech Crossroads at the MedHealth Summit at beautiful Ford Field. And we're just finishing up a wonderful day of sessions and have Dr. Peruvemba here to talk about HSR.Health and what you guys are doing, how you got your start. As we were talking just a minute ago, examining the unexamined data. You guys are doing some really cool stuff looking at data that many healthcare systems don't look at. But take a running start here for us, Ram, and tell us, what is the company all about?
Thank you. Thanks for having me. So HSR.Health is the health geospatial analytics company. Geospatial meaning we're analyzing data about location. That's basically what it means. And we are analyzing data that's non-traditional with regard to analysis in the healthcare industry. Normally in healthcare we look at people's diseases, their conditions, their diabetes, their heart failure, and so forth as data points. Here we're looking at non-traditional data like social determinants of health, environmental data, climate data. As we know, climate change is having an effect on a number of chronic conditions which can lead to poor health outcomes. So that's of critical importance going forward as the climate changes. So we use those sort of data points to really predict traditional health outcomes like readmissions to hospitals or patients with diabetes getting admitted or having poor outcomes and so on and so forth. And we can provide that information to public health so they can institute mitigation strategies or education strategies or reach out to communities that are particularly vulnerable. And health systems that might want to use the information to prevent rehospitalizations or take community actions through community organizations as well. It's becoming more important as those health systems are focused on their costs and so forth and trying to prevent unnecessary care, so there's greater emphasis.
There's been a lot of consolidation in that space and people are really struggling to catch back up.
Right. So, value-based care is coming. There's a lot of integration. That's right. There's integration of the payers with the health systems, and even physicians are being integrated. And they're all interested in reducing the risk for the patients. And historically, like I said, we've been looking at data around their past conditions and stuff that makes them high risk. Now we can say through our system, for example, that a patient who lives in a specific census block, zip code, is higher risk for a variety of factors that we weren't looking at in the past, so-called social determinants of health. Yeah.
And you're looking for predictive things based on the types of data that might be coming through the door. You're looking specific things for specific patients. This is more demographic, predictive of, hey, your population's coming from these areas, or this is what's happening in their climate, or something like that. You should be on the lookout for these things, or are you tracking specific patients through this?
Good question. I mean, initially our analysis is at the population level,
Okay.
right? So if a person comes from a specific locality, they're exposed to certain things based on the data we have. And we can incorporate clinical data as well, which would make the analytics more robust. But ultimately what we're doing is the population level. Now, when they come to the emergency room or the hospital and they're seen by a physician or nurse, they can be flagged through the electronic medical record as a high risk from the perspective of the population. At that point, a lot of times, believe it or not, what's happening is hospitals are going through a questionnaire, like 50, 60 questions, to see if the patient is exposed to specific social or environmental factors. But we will have narrowed that down because they come from a zip code. We've analyzed the top ones, the top 5, let's say. So that nurse can now go through those 5 and reconcile the patient to those 5 top priorities. And if they are exposed, because you can imagine if you're a patient coming in with diabetes and you feel terrible, someone comes up to you and says, oh, I have 50 questions to ask you. You're just going to be like, I can't go through all this. I'm in pain or I'm not feeling well, right? But if it's a few questions, Are you secure in food? Is your transportation adequate to get to your primary care? Then I think that's doable and reconcilable, and then that can be inputted back into our system.
You should
and
expect that this patient has a higher probability of these, say, 5 things.
Exactly, and then it'd be more actionable, it's more narrow, the focus, and that can initiate the social work care plan to address those specific factors, thus preventing, hopefully, in the long run, the rehospitalization or the poor health outcome that we're trying to look at.
I think it's neat that a commercial company is looking at these kinds of things, like I said earlier, examining unexamined data. These are not the normal bits of data that somebody or that a hospital system is necessarily even looking at in the same way that you are. But then it comes as a surprise to me because I think to myself, well, a research institution might stare at these things and over time they'll validate some outcomes and then eventually that'll make its way into practice. But you guys are a commercial company looking at this kind of data and working with hospital systems, and I think you told me earlier, perhaps other players too, not just hospital systems.
That's correct. Yes, a lot of our work in the last 3 to 4 years has been on really validating the product, right? Showing that we can use this non-traditional data to predict specific outcomes. And that's been done in conjunction through pilots with government agencies, public health agencies primarily, and that provided some funding to initiate those processes and run those pilots. But through it all, we always saw that our analysis indicated that when provided with this information, institutes could really develop a return on their investment, that there was a financial motive to it because let's say there's a model for a hospital to maintain or contain the costs for their patient population through Medicare, let's say, then by gaining these insights, they can address the most vulnerable populations. And they can address everything in an equitable fashion, right? That's a big buzzword now in the country and probably globally, that often health care is not allocated equitably. So they can do these things, and health equity itself has an ROI. In other words, treating the disadvantaged, who often use more of the healthcare dollars, really can provide a return on investment to a system which can go to their bottom line. So there we see a more traditional entrepreneurial way to utilize our platform, deploy our platform, developed contracts with health systems to use the platform. So yes, initially I think the belief and some of our work was research-oriented and validation, but now we are seeing that there can be financial incentives for public health and health systems to use the information to design mitigation strategies.
This gets to a point that Dr. Mickey Tripathi from HHS was making earlier today, that at some point, at some level, you have to recognize what the bottom line is for the various stakeholders and then design the way that you're moving forward to address that. And that sounds like what you guys are doing.
Absolutely, and it's just like a continuum of learning in a realm, I think, that has not really been approached before. And I think it hasn't been approached because it's a complicated process of moving from really a public good initiative to one that's sustainable, that has revenues and so forth. You had mentioned earlier that there might be other stakeholders who would be interested. Yes, I think the COVID-19 pandemic highlighted a number of things. First thing that it most importantly highlighted is that health and health equity has a dramatic impact on the economy at large. Everybody is affected, right? It affects the productivity of businesses. It affects workforce deployment, affects the supply chains and everything. So an understanding of health insights before they occur at the regional level or global level is very important for everybody. And I believe that eventually the health insights will be used by financial sectors and others to gain an understanding about what is going to happen in the future so that they can make logical investments, they can change supply chains and really be prepared for these health emergencies and not have the financial downfall that we had in 2020. Not just necessarily 2020, but 2020 and forward. So yes, I do believe that it's going to be valuable in the long run for more than just the traditional healthcare players. Yeah.
You mentioned the pandemic, and is this one of those things where when people are excited about something like that, they're excited about it, and when they're not, they're not, and then you sort of have to shift your strategy to be a little bit more bottom line?
Absolutely. Unfortunately, in an emergency situation, well, fortunately and unfortunately, obviously you have to act quickly in the emergency situation. And we were fortunate enough to be doing a lot of health work, and we provided some data to the World Health Organization through our pilots and through to federal agencies in the United States and to state agencies to deploy resources to the most needy and where COVID spread was most likely to be most severe, right? And that, of course, provided sustainability as the pandemic was at its height. But once the pandemic, of course, resided, or at least the infections decreased, we started to see less of an interest in the maintenance of processes that could allow the prediction of further spread and deployment of resources and so forth. So that's where I see that we need more than just the traditional public health and government agencies interested. We need more of the public-private partnerships. We need more interest from the private sector to realize that a future pandemic is going to be just as deleterious then if we don't act now. And so there have been the development of things like tech hubs and so forth, where we believe that we could provide data around health that might be incorporated with economic data, financial data, that businesses can use to say, these are the risks within our sector, so that they can be more prepared for their workforce and the supply chains when the next thing comes
But you're
along.
identifying a current need that satisfies, that also prepares you for the future pandemics and such.
Absolutely. And really when I say sustainability, it's a financial sustainability. It's an investment sustainability, right? There has to be a realization from the private sector. They have to make investments in this for the long-term implementation of, let's say, what's called a pandemic early warning system or something, which is very important. But as you can see, the interest in such is wanes politically, and it wanes based on the current situation.
Well, I'll never forget, during COVID, we were watching it very closely, and the government had actually funded a ventilator, a low-cost ventilator, for about $3,000. It had been developed, prototypes had been built, it was there, it was placed in the hands of a private entity. The private entity shut it down and just sort of gave up on it. And then everyone was like, wouldn't it be great if the government had a ventilator design that we could roll out quickly? And the answer was, technically we did, but it died because no one did what you're trying to do, which is to find that balance between, we do need this long term, but we've got to find a short term justification to keep it around. So applaud what you're trying to do there.
Yeah, it's a huge obstacle to sustainability of those sort of projects. I think it's more sustainable when you have an immediate ROI, and as a health system deploying a platform like us through licensing and things like that. But when you want something for the global good, which has an ROI that's tremendous, you need to get wider stakeholder engagement that's doesn't look to the short term, but looks more to the long term. And we actually, just to mention it, in the year 2022, actually, the Milken Institute brought together some stakeholders, for which I was a part because of our work during the pandemic. And the whole discussion was around a white paper to be deployed, which was published by the Milken Institute, to look at the financial sustainability of public health models. And this was really the cornerstone, was that private investment needed to come in for the sustainability. So,
And to find that justification for it. Yeah.
Right.
Oh, this is great. Who should be reaching out to HSR.Health?
Everybody now. certainly, we want to engage with the health systems for which we can provide these insights about the populations they serve. That would mean, the Trinities, the Henry Fords, and so forth. We believe public health, a lot of our validation was done in the public health realm, so we have good contacts there, but working with, larger government organizations and institutions is still, I think, on our pipeline. I think it's just by the nature of what we're doing. We do want to start to engage, like I said, the private sector and financial institutions and so forth, to show them the value of that knowledge. For that, it's not just a value for public good. It's a value that's going to affect them and their investments and the economy and so forth. And beyond that, we also want to make the platform available, especially since we're providing a generative AI front end, to the consumers, right? To the people to know what's happening around them in terms of the healthcare of the populations that surround them, what impacts them, what impacts their health system. I think that knowledge will be very valuable because then they will help in kind of leveraging all the partnerships that we need. When the consumer speaks, I think people will listen, that they want to live in a healthier environment and they want to have the resources to be allocated in a fair way, in a reasonable way for the full population.
Yeah,
So,
absolutely.
yeah.
Well, Dr. Ram Peruvemba,
That's
we're
right.
just so thankful to have you here with us today, and thanks
Thank
for coming
you.
all the way
Yeah.
out to Michigan and joining the MedHealth Summit.